Assalamu alaikum wa rahmatullahi wa barakatuh. Hello, dear students. I'm happy to meet you again. Our lecture today is under the topic of child abuse. I'm Dr. Amira Wahdan, Assistant Professor of Forensic Medicine and Clinical Toxicology. The goal of this lecture is: what is the child abuse? What are the risk factors of child abuse? What are the different types of child abuse? How to detect a case of child abuse? What should I do if I suspect a case of child abuse? Let's start with: what is child abuse? Child abuse is a form of child maltreatment, usually induced by parents or caregiver. The offender usually is the caregiver who care about the baby or the child. Sometimes these caregiver are his parents, and these parents do a form of maltreatment to their children, and so this is known as child abuse. Child abuse is also known by non-accidental injuries in children. Sometimes it's known as battered child syndrome. The second goal is: what are the risk factors? These are some risk factor of child abuse. Sometimes there is no risk factor. Sometimes the child abuse occur without risk factor. But these are some of the risk factors that may occur and lead to abusing the child. These include unwanted pregnancy, any cause of unwanted pregnancy. Sometimes the mother has children and they don't want or doesn't want to have another child. Sometimes the pregnancy is out the legal bond of marriage, so the female doesn't want to keep her child or doesn't want to have this child. If this child or the pregnancy continues and the child is born, she feels like hatred towards him, and this leads to abuse. Another risk factor is handicapped child. Sometimes the child has some handicap like cerebral palsy, other any handicap, autism, any cause of handicapping. These may lead to abuse. Sometimes the caregiver are abusers of drug or alcohol, and this leads them to be abuser of their children. Sometimes the caregiver feels social isolation, or they have psychiatric problems. These psychiatric problems may lead to making them abuser for their children. So the risk factors are unwanted pregnancy, handicapped child, drug and alcohol abuse, social isolation, and psychiatric problems. The third goal is: what are the different types of child abuse? Types of child abuse, actually we have four different types of child abuse. First, the physical abuse, sexual abuse, emotional abuse, and neglect. These are the types of child abuse. We will start to discuss them, starting from the emotional abuse and neglect, as they are difficult for the forensic physician or forensic pathologist to prove them, as they have no solid evidence on the child to be proved. So they are difficult to be proved or to prove that the child is exposed to emotional abuse, or but they have a difficult, or they have a very bad impact on the child. As emotional abuse, there is a proverb that say that you don't have to head to hurt. You don't have to head to hurt. Just saying to the child words which are bad words, this may cause psychological troubles to the child that may affect him a long life. So you don't have to head to hurt. Just saying bad words to the child may lead to very bad hurt to the child, even more than the physical abuse. The emotional abuse, like shouting at a child, saying to him bad words like "you are lazy," "you are stupid," "you are bad," you are a donkey," "you don't understand anything," "you have no benefit." All these words are very bad words, and it will lead to psychological problem in the child. Neglect is a wide range, have a wide range. It starts from just neglecting the child and not to care about him. You are busy busy with your mobile, with your reading, or with your work, and leave the child without hugging, without speaking to him, without talking to him, without listening to his words. This is form of neglect. The bad forms of neglect are to leave the child without doing his needs, like leaving him without feeding, without changing his diapers, without changing his clothes, without washing him. This may lead to effect like sometimes the child will have failure to thrive. He is not growing. Sometimes he will have some skin lesions because of being not clean. The end of the range of neglect may be proved by the physician because of the evidence that can be elicited from examination of the child. As regards sexual abuse in children is like sexual abuse in adult. So we will not discuss it in detail. You will discuss or you will listen to sexual abuse lecture in the course later on in adult. But we have 2 points we just must mention in this lecture. First of these points is you must avoid multiple examination in case of sexual child abuse. Why? Because multiple examinations, the child has a psychic trauma because of the sexual abuse which occurred for him. So you should not repeat this situation again by examination. So you will increase the psychological trauma. Sometimes the multiple examination, and the second cause is that sometimes the multiple examination lead to that the child think this is natural to expose his private parts and to examine him. So you must avoid repeated examination for these 2 causes. You should arrange for one examination. In this examination, you should arrange for being with clinical forensic physician, with the gynecologist and pediatrician. The 3 specialists should be present during this examination to write a full report without repeating the examination again. The fourth type of abuse is physical abuse. Here, physical abuse is usually episodes of violence inflicted on children. Episodes of violence inflicted on children. These episodes of violence lead to different types of injuries with different ages of healing in multiple sites of the body. And this is characteristic for child abuse. The different different types of injuries with different ages of healing in multiple sites of the body. This is characteristics of for child abuse. Most injuries in child abuse are non-fatal and may be sometimes child abuse single event, but in this case you will lose the special character of child abuse injuries, which is multiple injuries in different types or in different ages of healing and in multiple sites of the body. What are the common features of physical child abuse? We have different features. First of all, it occurs at any age. Any age of the children are exposed to child abuse, but the most common age for fatalities is under 2 years, as these children are very fragile and very weak to withstand the abuse. So sometimes the injuries may lead to their death, and the mortality rate is higher in the age under 2 years. It occurs in any social class. All social classes are exposed to child abuse or to abuse their children. It is not only present in the low social classes, but it is present in all social classes. The third character or their third feature is delay in reporting for hours or even days. And after reporting by the caregiver, reporting about the case, we have a child who has injuries in this place, there will be discrepancy and discrepancy in varying and changing explanation. You will find the father saying some explanation about the injuries, the mother is saying another explanation, the grandmother saying another explanation. So there is discrepancy about explanation of the injuries, why it occurred. And the fourth feature is the most common physical lesion are in the skin and the skeleton. These lead to the appearance of a medical proverb that says the skin and bones tell a story that the child is either too young or too frightened to tell. These proverbs remind us that sometimes the skin of the child and his bone can tell us a story. The child is too small or too frightened to tell us about it. He cannot tell us about it because he is too young in age. He cannot speak, or sometimes he cannot tell us about this story of abuse because he is so frightened from his caregivers to tell us this story. But his skin and bone can tell us this. What are the common injuries in physical child abuse? First of all, we have injuries in the skin, which are bruises and burns. Second, we have injuries in the skeleton, which are fractures. We have head injuries in the form of skull fracture, subdural hemorrhage, cerebral edema, and diffuse axonal damage. Visceral injuries in the intestine, mesentery, liver, and spleen, and eye and mouth injuries. To start with, we will start with injuries. We have two skin lesions which are very common. They are bruises and burns. Bruises is the cardinal sign, particularly those of different ages. If you find a child with bruises in different ages of healing, this must raise your suspicion about that this child is undergoing child abuse. Multiple bruises with different ages of healing, this should raise your suspicion about child abuse. Also, you should bear in mind that children are exposed to bruises because they are walking or running and they may fall a lot of times. So they may have different bruises or multiple bruises in their body. But if the child is under the age of walking, he is under the age of 1 year old and have bruises around the elbow or knee, this should raise your suspicion about child abuse and need a good explanation for the presence of these bruises. What are the common bruises suggestive of abuse? We have different types of bruises. The first one is finger tap discoid bruises. Finger tap discoid bruises, as seen in the photo, the arrows show the finger tap discoid bruises. These bruises are present around large joints, and this is an evidence of grabbing by an adult hand. Sometimes the bruises or fingertip discoid bruises are present on the front and back of the trunk, and this is an evidence of child being grabbed for being shaking. The child is grabbed for shaking, so we can find fingertip discoid bruises on the chest and back and front of the trunk and chest. Back and front of the trunk and chest. The second type is slap mark. As you can see, these are line of petechial hemorrhage, lines or parallel lines of petechial hemorrhage. These lines of petechial hemorrhage are commonly seen on the face, sometimes involving the ear. Sometimes they are present on the trunk and the buttock. As you can see in these pictures, the slap marks here are present on the face of these children. The third type is knuckle punches. What are knuckles? Knuckles is the joint between the metacarpal bone and phalanges, which is shown by the circle here. If someone gives a box to the child, he will have a row of 3 or 4 nearly round bruises. These bruises are usually or commonly present over the back, found on the back, especially over the spine, pony area, yeah, over pony area. Sometimes they are present on the facial bone. So this is caused by boxing the child or giving him a punch with the knuckle. The fourth type is bite mark. Commonly, the bite marks, in case of bite mark, the offender is the mother. But sometimes it should be differentiated from other offenders. Sometimes the offender is a child, another child, his sisters or brother in the home, or his peers in the nursery. To differentiate, you should look at the bite mark. If it is small, smaller in size or with narrow arch, this is for a child or another child who does or who did this bite mark. If it is larger with bigger arch, this is for adult one who did this bite mark. Sometimes the bite mark is caused by animal or pets inside the home, domestic pets, and these can be differentiated from human bite because animal bite is parallel row of bruises that may be associated with puncture wound caused by the canine of the animal, while human bite is two curved rows of bruises, two curved row of bruises. When we find a bite mark, we should do what? We should first take a photograph of the bite mark. Then we should do a swab for the bite mark. Sometimes this swab will retrieve saliva. And if the person is secretor, we can define the blood group of the offender. And sometimes we can do DNA fingerprinting for him. We should take measurement of the bite mark, and sometimes we can do latex cast for these bite. The fifth type is the benchmark. Benchmark is a butterfly-shaped bruise with one wing larger than the other wing because of the pinching by the thumb and other fingers. So you will have bruise with 2 wings. This is the benchmark. Sometimes or the sixth type of bruise is black eyes. Black eyes occur because of what? There is a differential diagnosis of black eye. Can you remember this differential diagnosis? Yes. Sometimes black eye occur from direct blow to the eye. This is the first cause. Second cause is blow to the forehead, which lead to migrating bruise in the eye, so it lead to black eye. Third is fracture of the anterior cranial fossa, which lead to black eye. Other type of bruises may occur due to using an instrument like stick, pelt, any instrument can be used for hitting this child, and it will print its shape on the skin of the child. Sometimes, as you can see in the picture on the left side, the child is tied by a rope or by any thread, which will lead to bruise at the site of the ligature. So these are the bruises, which is the cardinal sign of the second type of skin lesion is burn. Burn may occur due to different causes. It may be dry burn, or wet burn. In case of dry burn, it occurs due to either by hot object put on the skin of the child, like sometimes sometimes the mother may take the iron and put it on the hot iron and put it on the skin of the child. They like the picture on the right side. It will print the shape of the front part of the iron on the skin of the child. Sometimes the instrument is hot spoon or hot fork. Sometimes the mother heat that spoon or fork and put it on the on the skin of the child. It will also print the shape of the spoon or the fork on the skin of the child. Sometimes the dry burn is caused by cigarette butts. The cigarettes which will be circular in shape if the cigarette is both perpendicular on the skin of the child, or it may be triangular if it is both oblique on the skin of the child. In case of fresh cigarette burn, it will be red or pink in color. But after healing, it will be silvery in the center with a narrow red rim around it. This is the dry while as regard with burns, this is called scalds. It is due to using hot liquids. Sometimes the child is put with his buttocks and legs inside, dipped in with his buttocks and legs in the hot liquids. So he will have burn like on the picture on the right side, turn in the lower part of his body, including the gluteal region, perineum, legs, and foot. Sometimes there is spare area due to contact of the buttocks of the child with the bottom of the pot in which the child is put, like the picture on the right side, left side, sorry. Sometimes the child is dipped in hot liquids by his hands and feet, so he will have burn, which is known as glove and stocking burn. He will have burns in both hands and in his feet. These are known as glove and stocking burn due to dipping by his hands and feet in the hot liquid.